in Lane County. We deeply appreciate your partnership, your patience, and most importantly, the way that you have shown up for our members. They feel your care, and we are just really grateful for the provider network that we have and that we are building. We are going to give some updates today on where we are with the implementation, where we are with the expansion of our network, and be able to talk through some of the activities associated with Go Live on the 1st of February. So thanks for being here today. We will end with a Q&A session. We probably will try to limit the Q&A kind of during the conversation, just as some of those answers may come out naturally. But please hang on till the end, and we would love to be able to hear the questions you do have. And just as a note, we are going to record this meeting just so everyone is aware. And we'll probably stop the recording right before Q&A. So thanks so much. Okay, next slide, please. So this is a very, very scaled down synopsis of the work that has taken place over the last several months to be able to meet this February 1st transition timeline. Um, you can Sorry, my cell phone ringing in the background here. You can see kind of the high level work streams that exist here. You can see here we are on the 22nd of January. We spent much of last week down in Springfield doing an in-depth readiness review to kind of understand all aspects of our readiness to be able to receive these members into our care. And really happy and pleased to report that we have some things that we're still working through, but we are ready, and we are eager to get started with all of you. Member welcome packets are on their way, and will start being distributed next week. So members will start to receive those in the mail, along with their member ID cards, and just a welcome letter from all of us, and welcoming them into the Trillium family. Couple of things we're going to spend, Brandy's going to take some time to talk about network expansion, so I won't go into depth here, but did want to talk a little bit about operations and what you can anticipate kind of going forward. We are in deep with end-to-end testing, and that is really a dress rehearsal for understanding how enrollment files will be received, how prior authorizations will be done, how we will get payments out the door, and to ensure that all of those processes in a dress rehearsal kind of phase are going perfectly. And it allows us to preview any hiccups we might anticipate, and to have some risk mitigation in the background. So huge thanks to our operations team, all of the work going on in the background to be able to support that. Secondly, I wanted to draw your attention to the blue box and the gray box there that say hypercare, and just to give a little bit more explanation of what that is. And actually, we advanced one slide. I think we have some examples of what that might look like. Oh, maybe not. Maybe not on this one. Take it back one. Sorry, I gave a presentation to the elected officials last night, and we gave them a little bit of a sample. And so I just wanted to maybe give that to you as well. We'll bring it up later. But it allows us to kind of look at, high level, what our baseline for paying claims. And if we see a blip anywhere, we're able to triage that issue right away. So we will have essentially a command center that will be managing and kind of identifying any issues, and being able to kind of support members, support providers if anything comes up. So super excited about that. So next slide, please. I can't believe it's January. Frankly, I can't believe it's January 22nd, and that We are 10 days to go live with you all. We have spent a wonderful amount of time with providers of all types, behavioral health providers, primary care providers, specialists, HRSN providers, community-based organizations. We get smarter, better questions every single time we have the opportunity to hear from you all. So thank you for making this transition even better through your questions and through your concerns. We really do mean that. We still have some listening sessions yet to go here in January, and certainly in February, we will be having ongoing provider engagement conversations, weekly provider orientations, and certainly open to any community invitations for us to come speak to groups or forums that would be helpful. So thank you again for welcoming us and being so engaging. Next slide, please. Oh, here are the sample metrics for hypercare. My apologies. You can just see here just a little bit, a snapshot of the dashboards here, to give you a feel for how we're reviewing how claims are being paid, how we're reviewing how many calls are coming into the call center and the content of those calls, so that we have an understanding, and we can get smarter as more calls come in. So with that, just want you to know that we know there's going to be a hiccup or two, and we want to hear from you if something isn't going right, so that we can, as quickly as possible, remedy that. So please do contact us. We're going to give you contact information before this conversation is done today. Next slide, please. All right. And with that, I'm going to pass off to Brandy Thielman, who is going to take us through transition of care, just to kind of highlight again some of those transition of care, the timing of that, what that means, and what to expect. Thank you.
Yeah, thank you, Sarah. And perfect, thanks. So we have been preparing for this transition of care timeline here, and really appreciate all the questions, communication, everything that's been coming in from the community to help us prepare for this. And so when we look at the calendar here in January, Pacific Source's contract with OHA is still in place through the end of January 31st. So through the end of this month, everything will continue business as usual with Pacific Source. And then when we flip to February 1st, we will then have the onboarding process of transitioning all of those members from Pacific Source over to Trillium. We'll enter into that transition of care period, which I'm going to talk a little bit more on the upcoming slides. We'll stay in that transition of care period. As Sarah said, we're preparing as much as we possibly can to have everything go as smoothly as we hope it will, but we also are preparing ourselves to know that we will be encountering some bumps along the way. And as we've been meeting with many of you in the community, with our providers and others, just appreciate everyone saying, hey, we're all going to show up the best that we can, and we expect to have some bumps, and we're going to come together to solve those. So I think everyone's prepared for that. Really important just for that open communication, transparency, and making sure we stay close through this transition time. And then after, we'll go through the transition of care period, and then we'll have a post-transition of care period as well that we'll enter into for ongoing business. Next slide, please. So here is our transition of care timeline for those members that are onboarding with us February 1st. So we have members, our Medicaid members, the physical health transition of care period will be 30 days, along with the dental will also be 30 days. And then the behavioral health transition of care period is a little bit longer at 60 days. So you've got the 30 for the physical and dental, and then 60 days for that behavioral health. When we then look at members that have Medicaid and Medicare eligible members, or what we oftentimes call our dual members, they have a 90-day transition period for all areas of coverage: physical health, dental, and behavioral health. And then in addition to these two transition of care periods, we also have the specialty coverage time for the high-risk conditions. such as pregnancy, transplants, and other high-risk categories. For those situations, you will continue the treatment that the member started with the provider while they were a Pacific Source member. And then that will be based on how the provider makes the decision for the care plan for the member. That may end earlier or it may continue, but we will be following all of those care plans that are set up for the members from their providers. Next slide, please. So then we look at transition of care period. What does that mean for our in-network providers and what does it mean for our out-of-network providers? So if you're in-network with Trillium today, there's really no change for those members at all. Our contracts will be in place. We'll follow standard procedure. If you have any questions about your contract or those members coming on board, please reach out to us. We're having many of those conversations, but we know as we get closer, more questions are coming up. So please don't hesitate to reach out to your provider engagement rep and we'll talk through any questions that you have. For out-of-network providers, for our members, we can help them find a new provider that's in network if they would like, or they can continue to see their existing provider. And what they'll need to do is just contact Trillium for an authorization for those services. And again, remember, this is after the transition of care period. So during transition of care period, those authorizations will be honored. We will follow the process for that. And then once we exit that transition of care period, for those services to continue, we need to submit an authorization for them. In the next slide. All right, and so now we're going to talk about kind of some network expansion efforts that we have ongoing. So it in some ways feels so long ago, but also just feels like it was just around the corner. But when we started this journey, and we've updated this number a little bit as we've, from preliminary numbers, when we first received data, we have much more accurate data that we're working with now and continue to assess those numbers. But when we started this back in October, we had, for primary care, about 85% of those members that would be coming to us, we had their primary care provider in network with us already. And so that left a little bit of a gap for us to close as we move forward to February 1st. And so we had identified 3 key partners that we're working with, and we're just finalizing those negotiations with those partners and are expected to be able to close up to 98% of members will have their primary care will be in network with Trillium. So we do have a small percentage of members that we will need to find primary care homes for. We have capacity within the network and confident that we'll be able to have a home for those members. And we do have that transition of care period time that will be happening as well. And then for our behavioral health network, this is the other area that we've been very focused on for behavioral health. Similar numbers that you can see here starting this exercise. We had about 84% of members that were utilizing behavioral health services. We have those providers in network with us, and we've been expanding our network and closing out those contracts. And so on target for in February to have 97% of members will be able to continue with their behavioral health provider that we've expanded our network to accommodate those needs. And then, yep, next slide is good. And so what can our providers do to help prepare for this, right? Really important not to cancel any of the appointments with your members. Please continue to provide those services. Remember those transition of care timelines where we'll be honoring those authorizations. And we have some scenarios here that we're going to walk through and more information on that in the upcoming slides. But please don't cancel those appointments. Please continue to see the members. And if you're not currently in network with us and you would like to submit a request for consideration, please visit our website to submit that application. We have many applications that we're reviewing and are continue to expand our network. I also want to emphasize, while we have been really focused on expansion to support the transition of members coming on board for February 1st, we are network is an ongoing process, right? We are always expanding our network to meet the evolving needs of our members, and so we don't want this work to stop, right? It's not going to stop, but we want to make sure that we continue to receive that outreach, and we will continue to expand our network based on the needs of our members. Next slide. Think, all right, and then I'm going to hand off to Jeannie to talk about some changes that we've had in our workforce to help prepare for the onboarding of these new members.
Yep, and just going to make sure my audio is okay. It's like you can hear me. Okay, okay, excellent. Hi, everybody. Jeannie Savage. I use she and her pronouns, and I'm our Chief Medical Officer here. Welcome. I'm glad you're here. I, as well, can't believe it's January, and I'm very excited that it's January 22nd because it's my birthday, turning 56 today. So, for all of you fellow Aquarians, I love the water sign. Excellent. And welcome to your birthday in January to talk a little bit about our workforce growth. We can't do this work without getting a little bit bigger ourselves. We've done some amazing hiring and have been able to really look at our communities, see what's needed, and added workforce to do this work and to make this transition successful. We held a town hall, kind of an opening, discussing specifically with Pacific Source and some of their team members who unfortunately had to transition in this process as well. And many of them have come aboard. And so we've had a great connection with the community and looking at our workforce and the growth. And it's been really fun to welcome some new members here. As you can see, we're nearly twice the size as we were before. And it's fantastic. We appreciate that. All right, Dominique, on to the next slide. So one of the ways that we found is a good way to kind of communicate things to providers and community members is to go through kind of a question answer and asking those questions that we've been getting over this process, which, as Sarah alluded to, have been really fantastic questions and have increased understanding. So one of the questions I'm going to start with here is, what are the billing processes, payment timelines, and methods during and after the transition? And then I'm going to call on Brandy to walk us through that.
Yeah, thank you, Jeannie. Really important question as we're approaching this timeline here, and as you're continuing to see those members. So for dates of service and or admissions that are prior to February 1st, so all dates of service January 31st and prior, you'll want to continue to bill Pacific Source for those services. So our claim processing will follow the date of service. If for some reason we do receive a claim for a date of service prior to that February 1st, you will receive a denial for that. If you have any questions, feel free to reach out, but you'll want to make sure to bill Pacific Source for those dates of service January 31st and prior. Then February 1st and going forward for those members is when you'll start to bill Trillium, and we'll receive those claims, we'll start processing them. And that's where that process that Sarah reviewed earlier, that hypercare work, is going to come into play. And we're going to be closely monitoring and watching all of those claims that we're receiving and ensuring that they're going out accurately and timely. And if you have any questions or need additional information, we have a link to our website here. And then please don't hesitate to reach out to your provider engagement rep. And I know we're doing, as Sarah mentioned, weekly orientations as well of how to submit claims and resources. So please attend one of those and or reach out to the website or engagement rep for any questions.
Excellent. Thank you, Brandy. Appreciate that. And we will go through all questions. We're going to get to the question and answer section and then go through those. So, Lynette, I saw that. Just keep it, and we'll either answer it or we'll get to it. We'll either answer it through our questions here, or we'll get to it in that question and answer session. Okay, next question. My behavioral health provider is out of network. Can I still see them in March? And Brandy, I'm going to come back to you again for this one.
Yeah, absolutely. Thank you. Yes, so behavioral health transition of care, remember, is 60 days. So you have 60 days from February 1st for that transition of care. And if your provider is not in Trillium's network and the 60 days are over, you may continue to see your provider. However, they'll need to reach out to Trillium for a prior authorization to continue seeing you. If your provider is already in Trillium's network, a prior authorization is only needed for certain services, and your provider will verify that for you.
Yes, and Brandy and I have been doing this in tandem as well as Melanie, just with everybody. Please continue to see your members and the patients in the community. It's very, very important that they have continuity of care with you, and we can work out the rest in the background, and we will continue to support you seeing those members. All right, next slide. I have a child with special needs. They are getting services out of state. What do I need to do? And Brandy, I have you on for
Yes,
this.
perfect. Yes, and yes, that consistent theme that we have continued to share, right? We really want our members continuing to see their doctors, um, continuing for your children to see their doctors. And if your child is getting help from a Pacific Source case manager, Trillium, we're going to receive that information from Pacific Source. So we've been working very closely with Pacific Source and OHA. Melanie, who you're going to meet here very soon, her team has been in close connection receiving all of that information to ensure that we have warm handoffs and support happening on the case management side. And then if your child doesn't have a case manager and would like one or has any questions about the case management team, please call our Trillium member services after February 1st at 541-485-2155 and ask for a care manager for your child, and they'll be able to get you connected.
Excellent. Thank you. And then my last question for you, Brandy, is I am planning on giving birth in February. My provider is not in Trillium's network yet. What should I do?
Yes, thank you for this one, Jeannie. And this is on that transition of care slide that talked about earlier. This is in one of the special categories, right? Continuing for those pregnancies. So again, you're going to want to keep seeing your doctor. Do not miss any appointments, even if your doctor's not in Trillium's network, right? So following those transition of care rules, the care before and after delivery will be covered during the transition period. And this care ends when your doctor says your treatment is complete, right? So really important to stay connected with your doctor, continue that care plan is outlined by your doctor, and that will end when your doctor says it's completed.
Yeah, and I love this one and just really want to stress to everybody how important those postpartum visits are. And they may be arranged at 2 weeks and 6 weeks, but the reality is that postpartum care is based on the individual. And if your provider thinks that you need to be seen in between weekly, whatever it is that your provider determines as the plan of care with you, and you guys are on board with that same plan of care, we're going to support until your provider says, okay, we're doing great. The postpartum time has ended. This is all good. So it's that those postpartum visits are just as important as during the care. It's during your pregnancy. They're very, very important. So continue to see your provider. All right, so we're going to jump to our next set of questions, and this time Melanie is going to be my partner. So Melanie, how will prior authorizations be transferred?
Hello, thank you, Jeannie, so much. Hi, everyone. I'm Melanie Westrick. I'm the Vice President of Population Health for Trillium, and we are getting a file feed of authorizations from Pacific Source. So all those approved authorizations will be transferred over from Pacific Source to Trillium. So providers and members don't need to do anything for those approved authorizations. We know this is an important area and we're paying very close attention to ensuring these authorizations get transferred. Back to you, Jeannie.
Excellent. Thank you. All right. So move to our next one. How will prior authorizations for retail and medical pharmacy medications be handled?
You bet. Thank you, Jean. And again, we know, again, we keep emphasizing the importance of continuing to see your provider. And we know that, members getting their medications is so, so important. Trillium will honor, again, approved prior authorizations for medications with the Pacific Source approved end date. So all those authorizations for retail and medical pharmacy will be coming over directly from Pacific Source and will be honored through the Pacific Source approved end date. If there's any adjustments that we need to make, our pharmacy team will work closely with providers to transition members to preferred options by following the benefit process.
Yeah, and I love to add, many of you know Shauna Wick, our director of pharmacy, who has been working with us for a number of years, over 2 decades, so just or around 2 decades. Just be very comfortable that Shauna is on it, as many of you know, and she is tracking this very, very closely. All right. How will authorizations for members with specialty coverage for high-risk conditions be managed?
Yeah, you bet. Another great question. Trillium will honor, again, similar to the pharmacy scenario, Trillium will honor Pacific Source approved authorizations for these services through the Pacific Source end date. So these are those members that are covered under the transition of care rules for things like pregnancy, cancer, medically fragile children. So for those specialty categories where members are high risk, we'll be honoring those through the Pacific Source end date.
Excellent. Thank you. I'm hoping as we go through these, folks, that you're starting to feel like, okay, they're thinking about these different scenarios, these different situations that we are going to encounter, and starting to breathe a little bit easier. We really want to focus on the member is at the center of the care, right? So if it is the best thing for the member to continue that medication while we work out any sort of transitions, that is going to happen. I really want everybody to be able to take that deep breath and feel more comfortable as we go through these questions. I know more questions will arise, but as we go through this, I'm really hoping that everybody's kind of starting to breathe a little bit. Okay, next one, I think, Dominique. Great. So what happens with other medical prior authorizations, Melanie?
You betcha. So again, we know, I think you can sense from these all these questions that we're trying to address on authorizations that we know how important this is to everyone. And so what will happen with other medical prior authorizations is services scheduled on or before June 30th will be honored under the Pacific Source approved authorization. So any auth that's approved through Pacific Source, all those authorizations are honored through June 30th, excluding the specialty populations we just talked about. But for services on or after July 1st, providers do need to submit new prior authorization requests to Trillium.
Excellent, thank you. I know that scheduling in specialty areas for surgical OR room, et cetera, is difficult. It's not always done in that first 30-day transition. So I really appreciate that we are saying, let's move it out, because I'm scheduling 2 months out, 3 months out, and this is going to help us and our members make sure that they can relax as well and know that their authorization is going to be honored. So I really appreciate this. All right, on to our next one, Dominique. What if Pacific Source has denied a prior authorization? What do I do, Melanie?
Eugenie, if Pacific Source has denied your prior authorization, the provider and member can file an appeal with Pacific Source for up to 60 days following the denial. So if Pacific Source issued the denial and you want to appeal the denial, you need to go back to Pacific Source to appeal the denial, and you can do that for up to 60 days.
Excellent. Thank you. Appreciate that. All right. And I think we have one more scenario to go through, and I get to answer this one. What if my medicine is not on Trillium's formulary? What happens? And you can see immediately when we in this transition of care, if a member goes in and it's not on our formulary, they're going to get that first 30 days, no problem. We're going to say let's we're going to fill that right away. We don't want members to go without medication. Insulin is a big one. People get on change insulins or on routines with their insulins, and switching that can be very difficult. We are working one-on-one with those members, with those providers to say, is this a switch that can be made? If it can be made easily. We're going to make that switch between the member and the provider. We'll work together. Sometimes those transitions can take longer, and we're definitely going to allow for time for that to happen. If for some reason your provider says it's absolutely imperative that this member stays on this medication, we will honor that and work with them and work with you, with the providers and the members, and honor those. There's been times when members have tried every medication and the one they're on is, while it's not on formulary for us, maybe the one they need to take. We are going to work with you and your provider on that, and be very accommodating, as we want your health, that the member of the health is at the center. So there's a lot of leeway. We're working together, and Shauna and her team in the pharmacy are already reaching out to those clinics that have embedded pharmacists to work together and say, hey, let's look at these members that have medications that may not be in our formulary. How do we work together to get them transitioned safely to a medication that's equally as efficacious? Or is this a medication that they've tried multiple things and they need to be on? And we're really working on that upfront right now before February 1st, to make sure that members are, like I said, at the center of what we're doing. We value that. We value the health and we of our members, and we value what the work that you all have done in with those members in achieving health. So just be reassured that this is a team approach. Okay, and I think after me, I get to hand back to Sarah. Thank you, team.
Hey, thanks, Jeannie, and thanks everybody for the great information. I think we're going to stop recording now. And actually, our first question